perfect storm is a set of conditions will lead itself into a major storm development with a tremendous amount of energy in the storm. The perfect storm for diabetes typically has several factors, things that come from the outside, things that come from the inside, that will lead itself to under-response, overreaction, and more under-responsive tissues to finally end up into the vicious spiral of a nightmare called diabetes. Some of those factors that are more commonly noted are stress, toxins, malnutrition, and lack of exercise. Endotoxemia is toxic particles that come out of the gut. Typically they're from microbes or bacteria, yeast, fungus, parasites, little parts of those that get into the bloodstream and create toxic reactions. That will start to cause systemic inflammation, which can lead itself into a metabolic syndrome. The Western style diet is one of the biggest ways to increase the endotoxin levels in our blood. It does that by feeding bad bugs with the things they want to grow. That will tend to make the good bugs in the gut die off, and then the storms start. It's the bugs or the bacteria in the gut called the flora that does about 95% of our digestion. It's one of the biggest foundations of health there is. When we look at some of the things that we consume, fructose will dysregulate the blood sugar. High fructose corn syrup does that pretty much on steroids. It will lead into too much insulin in the body, too much triglycerides, that leads to insulin resistance, hypertension, which starts a vicious snowball cycle going that never ends. They've done studies where they took fecal matter out of healthy, thin people and injected it into unhealthy people, and the fatter people got quite a bit better after having that happen. That just lets us know that flora is consistent from the mouth all the way through in the colon. The colon is very important to keep that healthy. Dietary consumption and calorie intake have a huge impact on how the bugs in the gut will grow. Good, healthy foods will make it healthy. Unhealthy foods will make it not healthy. Unhealthy foods are typically junk food, things you buy in bags. The microbiota or gut flora has a tremendous amount to do with insulin sensitivity. It will be kept in health by what we eat. It starts to affect multiple body systems and ends up resulting in insulin sensitivity for many different reasons. When we look at our fat intake, which is something that's really common in bagged food, the saturated fat, in the example here is palmitic acid. The saturated fat tends to make our cell membranes very rigid. They don't move with things. They're fairly fragile. The unsaturated fats make the fluid membranes, as you see on the left. Those are where the healthy ones are. They move with things. They allow for proper function without all the membrane. Palmitic acid is one of the more commonly known saturated fats, but all you have to do is look at the labels on your foods and see what the saturated, unsaturated fat content is. Soy oil, olive, corn, peanut, they all have a fair amount of unsaturated fats in them. The hormesis, that is how the environment outside affects the cells inside, and diet has a huge effect on that. The healthier the diet, the more balanced the body is within, and the longer the lifespan we have. Typically, the unbalanced diet creates inflammation, and the inflammation will lead to a host of things we will look at a little bit later. Exercise can quickly reduce blood sugar levels. If we look down toward the bottom, the body doesn't store that much energy. The liver, through the starch called glycogen, will only store 18 minutes of energy. The blood has 4 minutes. If we take the stores in the muscle themselves, that's 70 minutes. Add those two together, we're only talking about 2 hours of energy, and then we're completely depleted. The body has to constantly take things in and change the food stores we have inside. This lets us know that exercise, and the harder we exercise, the faster it will drop the blood glucose in our body. The watts are the amount of energy expended in the exercise, and the more exercise there is, the more it will decrease, just burn up the glucose that's available in all the tissues. We have an endocrine control of blood sugar. The one hormone that typically is looked at the most is insulin. It comes from the pancreas to the beta cells, and that drives the sugar out of the blood into the different cells. The alpha cells in the pancreas do the opposite. It releases a hormone called glucagon, which increases blood sugar. Adrenal hormones, they're typically steroid hormones. Those will dramatically raise the blood sugar, and that's one of the biggest causes of diabetes, is adrenals just constantly responding to too much stress. Thyroid hormones will control how much energy we burn, and growth hormone will increase the amount of food sources in the body so we can grow. This is a negative feedback loop of the thyroid. This is how all hormones work. The hypothalamus in the brain, it reads how many circulating hormones are there. It communicates with the pituitary. The pituitary releases some type of a hormone to a target gland. In this case, it's the thyroid, which pituitary is releasing TSH. That goes to the thyroid gland. The thyroid gland combines iodine and the amino acid tyrosine to make thyroxine. The thyroxine is converted in other tissues, about 30% in the liver and the kidneys, about 70% in the muscle and brain, into T4, T3, T2, and T1. T3 is the most actively studied of those hormones, and those go and affect every cell that we have. The thyroid is supposed to control our metabolic rate, or how much energy we burn. That will control our weight. It has about 50% of the control of the menstrual cycle, and also controls our body heat. The way it does most of that is it affects what's called the mitochondria. Mitochondria look like this. They are the powerhouses of the cells inside of your body. The thyroid hormones will determine how many mitochondria are in a cell, how big they are, and how active they are. This is a dying mitochondria. It's dying because of toxic loads that are going on inside of the body. This is a chart on how we make energy. Most of the energy we make is in the purple circle in the center, where inside of the mitochondria itself. If the thyroid is depressed, it's typically going to make somebody look like this. They have lumpy, bumpy, excessive weight everywhere over their whole body. It's hard to get clothes back on, and constantly have to get bigger clothes. The adrenal gland is another gland that's highly associated with diabetes. It's your stress gland. It controls the inflammation responses, immune responses, stress blood sugar. It will determine how much fluid is resorbed back from the kidneys and how much goes in the toilet, also your posture and blood pressure. It does this through the same negative feedback loop as we saw in the thyroid. The hypothalamus reads how much hormones we have. It communicates with the pituitary, which sends out hormones into the target adrenal glands. The cortisol, one of the things it does, it targets the muscles. It makes the muscles liberate protein. The protein is converted in the liver into sugar, and the liver then releases that sugar. It takes its sugar stores and dumps them as soon as cortisol hits it, and that's one of the main ways that the blood sugar rises, even though you're not eating in a way that should keep the blood sugar high. Metformin is supposed to inhibit the conversion of the liver from proteins into sugars. This is typically what somebody looks like with adrenal burnout. The thorax gets a large hanging, sagging abdomen. The large muscles, like the arms here, are looking thinner than what typically should. In a male, it will typically give a feminizing effect with start to grow man boobs. Women will typically start to give facial hair. One of the effects that happens with stress and the cortisol production is normally we will start to make our hormones through cholesterol. That'll drop down on the right side into the hormones that will make a man and a woman a woman. When we're highly stressed, the adrenal drives the hormones that would be targeted to become testosterone, estrogens, progesterone, into cortisol to raise the blood sugars, and we cease to make the hormones that make us men, and this will also drive some other hormonal problems. The main problem it will drive is the aromatase. Once the blood sugar starts to rise, the insulin starts to rise, starts to give us fat tissue deposited in the abdomen typically. The fat has a whole bunch of hormones. Aromatase is one of those hormones. Aromatase will make your circulating testosterone and estrogens convert into toxic hormones. It takes the testosterone, it converts it into toxic estrogen, takes healthy estrogen, converts it into toxic estrogen. That is increased with cortisol plus insulin. Cortisol or hypercortisol in circulation will raise the blood sugar. It'll always have insulin, so it always turns this on. Once again, this is a typical look of adrenal burnout in several men. This is the look of a woman with the same type of thing. She has an added factor with the toxic female hormones, making the hips much larger than what they should be with this also. Diabetes typically has this progression. The blood sugar rises, insulin rises to follow that to try and get the sugar in the cells quit responding. That makes us have more insulin. As the blood sugar continues to rise and it starts a vicious cycle, it ends up burning itself out. That's how we get type 2 diabetes. Type 1 typically is a food intolerance that causes autoimmune problems. Autoimmune issues start to attack the beta cells in the pancreas. They quit making insulin. The body doesn't respond that way. So those are the two primary mechanisms this happens from. If we look at insulin resistance, it's typically going to stimulate all kinds of hormonal problems that can end up creating PCOS or polycystic ovarian syndrome. It'll create infertility in both men and women because of what it does to the male and female hormones. When we start to lose the control of our blood sugar, it starts to decrease our memory issues and we start to have learning difficulties. Then we start looking at the literature to try and see how we try and address these different things. One of the hardest things is that people are paid off or have ulterior motives with the research. 40% of the research in the U.S. is considered to, or throughout the world is considered to be twisted, have a spin on it, up to 70% in the U.S. And this shows that metformin, along with other medications, actually increases the mortality or death rate in people. The best results of the medicine approach to diabetes is just to use one, according to this study. Here's a study showing that most or a fair amount of the literature that puts it out there is fraud. It's not error, and that's way more significant in the U.S. 8 times more fraud than error in the U.S. to try and deceive people with supposedly good studies. 40% of the world's literature has been twisted to have spin on it in at least 2 sections of the main text. So we start looking at the reality of the disease. The intensive therapeutic approaches of multiple medications results in a higher death rate. Typically, people are used fasting glucose blood levels to determine diabetes, but a better way to do that is use hemoglobin A1C. You don't need to fast with it. Hemoglobin A1C shows the long-term levels of sugar in the blood. The normal levels are below 5.7%. Pre-diabetes, 5.7 to 6.4. Diabetes, 6.5 and above. Typically, it's a finger stick. Read in a mirror meter like what's shown right here. Pretty instant results. Diabetes has a ton of complications because with the increased blood sugar, it creates inflammation in every tissue we have. Start to create degeneration within the nervous system. The eyes are part of the nervous system, so it'll destroy the retina in the eyes, the nerves, predispose us to stroke and heart disease because the increased blood sugar increases the lipids. That creates inflammatory response in the blood vessels. The inflammatory response creates injury. The injury is followed with cholesterol. That starts to build up plaquing in the medial wall of the arteries. It increases blood pressure, and it goes on through there. Typically, whenever there is a problem with the blood sugar, there's also a problem with the blood lipids. And insulin resistance skeletal muscle is something that can start to cause plaquing within the arteries. One of the common approaches to try and deal with the lipids in the blood is to give statins. Statins increase the resistance to insulin in the muscles, which is one of the primary tissues we use to burn the glucose up. So that'll keep the blood glucose levels higher, keep inflammatory rates going, and destroy other tissues. Diabetic neuropathy typically happens through a problem with the blood vessels. The blood vessels start to degenerate. The axons are the communication highways of the nerves. When the blood supply is disrupted in those, they start to break down the insulating factors on the outside, much like insulation of wires, and they start to short circuit, and then we have problems. Mediterranean diet is still one of the healthiest ways to approach things. Decreases death rate in all manner of disease. When you look at diabetic neuropathy, it creates lesions like this on the foot, great big huge problems with the circulation. It starts to make the tissues die. Some simple ways to approach that are simple products like alpha-lipoic acid, shown to reverse diabetic neuropathy. L-carnitine helps with that. Another one with alpha-lipoic acid, showing another vascular lesion in the bottom of the foot, helps with that quite a bit. Resveratrol is another one that helps with these. When you look at weight loss, it's one of the best options for diabetes. The problem with conventional methods of weight loss, people just do fad things. They don't stick with it. It doesn't become a lifestyle. So they start to look at bariatric surgery. They say it's more successful, but that destroys your ability to digest proteins. It destroys your health because of that, and the health starts to fall off a cliff shortly after you have that. It definitely has an impact in diabetes, but there's a lot healthier way to do it, and that the surgery forces a person to change their lifestyle. They could do it by choice and retain the ability to absorb and digest their foods. When you look at the problem with type 1 diabetes, that's insulin-dependent diabetes, typically the beta cells in the pancreas have had an autoimmune response start to attack those. That autoimmune response commonly is associated with celiac disease. Here's an association with cow's milk. Typically what happens, the picture up above is what a normal lining of the intestine looks like when there's chronic inflammatory issues from dietary imbalances. The lining of the gut starts to look like the picture down below. It starts to leak, allows toxins into the bloodstream. Those overwhelm the liver with toxins. Once that's overwhelmed, the toxins start to deposit in the other tissues. Pancreas would be one of those that can add to the autoimmune response. It'll also keep the adrenal glands responding to stress. That will keep the blood sugars up, and it's a huge issue. When you look at some of the celiac issues, one of the real reasons why wheat is toxic, most of our grains are toxic in the U.S., is because the GMO grains can't resist the other parasites that are there or other plant materials that want to grow around them, so they have to spray them, and the sprays are what makes things really toxic. Typically the grain crop in the U.S., 95% of the hard wheat crop, and a lot of the other crops are sprayed with Roundup within a few days before harvest, and they just put toxic grain into our food supply. The toxic grain starts to destroy the lining of the gut and the bacteria that grows inside the gut and gives us celiac disease and other problems. Here's a normal lining of the gut on the left, celiac disease on the right, creating a leaky gut and that whole nightmare that goes on with that. Typically, whenever you change the lining of the gut, it starts to increase exposure of microbial or parts of the bacteria called LPS that will start to create autoimmune responses and overload the liver. The reason why it overloads the liver so much is all the blood return coming off the gut, the stomach, it goes straight to the liver so the liver can process any bugs that have slipped through the gut barrier along with all the toxins that are there and store all your foods. So it'll overload the liver, and once the liver is overloaded, we can't process our toxins. The toxins start to spill out through the rest of the body and creates autoimmune responses that way also. Liver is supposed to catch and destroy bacteria and pathogens, store your food sources, make sugar from protein when it's stressed, clear your body of toxins, and make bile. This is what happens when there's chronic inflammatory responses going in the gut lining. It literally blows holes in the lining and allows it to leak, overloads the liver, and then you have that part of the problem added in. This is another issue that goes on. Candida infections can get incredibly bad. That can create the whole problem that leads to celiac disease also. I don't believe I've ever seen a case of celiac disease that is not associated with candida and other dysbiosis or flora problem in 25 years of practice. The LPS is the particles of the bacterial walls and fungal walls, things like that, to get into the bloodstream. It starts to create a massive autoimmune response throughout the rest of the body. Then we add to the autoantibody production viral infections that will increase it and really accelerate the autoimmune response. When we start looking at some of the factors that will decrease that, or this one shows that type 1 diabetes can be initiated by a viral infection, and then you add the food allergies on top of that. That's how that starts. Glutamate can be a factor in killing off the cells. Typically that'll happen when there's too much of a oxidative or free radical damage that's going on, increases in glutamate, and that can make the cells toxic and create the autoimmune response that way. When you start looking at some of the positive things that can be done, niacin has a 60% reduction in type 1 diabetes. Vitamin D has a huge impact in decreasing even type 1 diabetes. Gandoderm is another thing that will stop the autoimmune response to killing off the beta cells in the pancreas that creates type 1 diabetes. It also will help work with the type 2 diabetes also by lowering serum glucose levels. There is a dramatic breakthrough finding that happened a little while ago where a pharmaceutical called topiramate, it's a GABA facilitator, will help regenerate the beta cells in the pancreas. This is a therapy that could be used after restoring gut health, minimizing the hormonal responses, getting the adrenals under control, blood sugar in control, changing the lifestyle, the dietary lifestyle. Then this could be a really good option to rebuild the beta cells and get people totally off of insulin if the niacin